So I'm a medical doctor and I work as a consultant medical microbiologist. And that means that my role is to diagnose, treat and prevent infection caused by microorganisms. So those are bacteria, viruses, fungi and parasites.
It's got lots of positive cultures, so they've repeated that. They would repeat it after 1 dose of cefuroxime.
Microbiology is incredibly important. We're surrounded, we live in a microbial world. We're covered in bugs, we have microbes inside us, and the environment's full of microorganisms. And infection affects every single one of us. This is one of the best bits of the job. Dealing with a patient, someone who's sick, wondering what might be wrong, starting best guess antibiotics and then coming in the next day and having a look and seeing what's growing. No 2 days are ever the same because actually you never quite know what's going to grow. But a typical day will be 9 to 5:30. We start the day with a handover from colleagues who are on over the weekend or overnight, and then we'll usually have a clinical or educational meeting in the morning. Then the rest of the morning is spent undertaking laboratory liaison where we find out what's growing and whether we need to do any further work to identify bacteria or what's growing in the lab. We'll then go and see patients at the bedside and do the intensive care ward round, as well as phone out or authorise those important results to the teams who are waiting for those results. In the afternoon we may have a team meeting, for example infection control, or I would, for example, have the antimicrobial stewardship team meeting. And we also take the time to do teaching sessions. That might be lectures to undergraduate medical students.
All right, Matt, come on and show me.
And are you happy that we read it? What would you have read that at? So yes, actually, microbiologists have a lot of patient contact. We see all the patients on the intensive care unit every day. So we conduct a ward round daily. And we also go and review patients with difficult or complex infections at the bedside. Colleagues who are also trained in infectious diseases, or those who deliver outpatient antimicrobial therapy services, they run weekly clinics. So we have regular patient contact and daily intensive care ward rounds. I think when you actually go to the bedside, meet the patient, it really helps put the pieces together. You actually get to understand the impact of the infection and seeing people get better, seeing the effects of your advice or your diagnoses, your therapy, actually making things better for patients. I think it really does. When I'm at work, I'm really busy. I never notice the time, but then I think there is that lovely chance to step away because you know you've done a good job. You've had a lot of job satisfaction when you're there, and you can step away and switch off. As a microbiologist, you're on call, but that's often from home, so it's very manageable with a family life as well. And I find personally that I can really enjoy the time I'm at work, but also unwind and switch off. Enjoy my family and friends when I'm away from work. I actually work less than full time, as do some other colleagues in my department, and that's very achievable. And it really works particularly well for microbiology because we don't have our own inpatients, because we serve all patients. We can work out rotas that work for people and also fit in their other interests to make sure that that division of care is very equal. I'll admit, I love the subject. It endlessly interests me. I never get bored with dealing with infection and bugs. So the subject I really enjoy, but I think the best part for me is working with colleagues. That's both inside the department and across the hospital. I find it really stimulating. I learn such a lot from dealing with my colleagues and speaking to them and working with them. It's very rewarding. And of course, I feel in my job I can really fulfil my vocation. I really do think that we're making a difference, and that gives me great job satisfaction as well. So I really do enjoy what I do.
There you go, there's something.